Hi everybody. So today I will be covering a very important area of therapy called couples therapy, and I have a lot of my patients that ask me if we do any specialization in that. So when you do clinical psychology as a field, you specialize in all types of therapies, but yes, if you want to do any extra work or understand the therapeutic approach a little more, you can always get into it a little more in detail by doing some kind of specialization in different modalities under couple therapy. So even for couple therapy, there are different approaches. EFT is one of the most common ones. It's called emotion focused therapy. And yes, we do, as clinical psychologists, as psychologists, we do take on cases of couple therapy. Sometimes you can be more inclined towards one type of approach. I personally enjoy it a lot, and I have seen a lot of sessions with my patients as well. It is a very interesting area as well, for those of you who inquired about the same. If you have any specific questions, you can ask me, but I did get a few questions about what exactly we do in those sessions, so I will give you a little bit of detail on that. So EFT is basically an emotion focused approach to couples therapy where you kind of cater to the emotions and the attachment process of both the partners, right? So what, like we spoken about earlier as well, that attachment is something which is very individualistic. So one person might have an anxious attachment, some person might have like an avoidant attachment, and one partner might have a secure attachment. So when you're in a relationship, it's very important for you to sort of complement each other's attachment styles. And in couple therapy, we try to understand your issues from from the lens of your attachment style, right? So we try to understand, why does one particular partner necessarily behave a certain way, and why does another one behave a certain way. So that will allow us to understand their attachment and where all of this stems from, and then we kind of cater to it. And personally, it has worked with me, it has worked with my clients, and it's an area that I genuinely enjoy. I usually use the EFT approach in couple therapy, which is the emotion focused approach, but that is not the only approach. There are multiple approaches in the emotion focused therapy, I mean in the couple therapy, right? So you can use different approaches depending on your client's requirement, right? Another question I was asked is, do I, when we see patients who are getting married, they have this premarital counseling. That is something which is a little different. That is just for people, that's kind of like a cohort or like a group that is formed, where people individually are going through the same emotions, like, say if it's like a new bride, or if they're going to get into the process of marriage, then every person who's going through that, they can have like a group therapy session where they all let their emotions out and they talk about how they're feeling. But that is not the same as couple counseling. Couple therapy is totally different from that, right? This is more like the premarital counseling is completely different. That can happen individually with the bride or the groom, but it can also happen with the couple together as a whole, right? So you can always have premarital counseling where the partners, they come together with you, in front of you, and they talk to you, and they basically understand where they're at with their relationship. Mostly in the case of love marriages, because it does happen in arrange as well, but mostly in the case of love marriages, because you've been with somebody for a really long time, and of course the expectations will be more according to that. And basis that, you just kind of understand each other's attachment, you understand where you're making mistakes, where the other person's making mistakes, and you kind of work on it together. So that's what premarital counseling is. And all of the stress that you have pertaining to the marriage, things that need to be spoken about, things that are being avoided probably, or one partner's reacting too much for something, so all of those things are dealt with in your premarital counseling. And it is similar to couple therapy, but couple therapy can be at any phase. It can be pre-marriage, post-marriage, but premarital is specific to the marriage aspect of it, right? So yeah, these are the questions I got on couple therapy. People had a lot of doubts, and what modalities we use. So multiple modalities can be used for it. So the constant question that I am also asked, what kind of marriages do I resonate more with, or what kind of patients do I see more? So guys, just to put this out there, as therapists, there is no option, choice, or judgment that comes into play. So any and every patient is always welcome. I don't have any specification in mind what kind of marriages or what kind of partners I deal with more. But just from a personal perspective, if you ask me that question, I resonate more with love marriages, yes. but that does not impact my patient interaction at all, because as therapists we're always going to be non-judgmental, and the space is always going to be open for you to come and talk about anything that you truly feel, and it doesn't matter where it comes from. The only reason why I resonate more with the process of a love marriage is my own personal perspective, and I've always been like that since I was a kid, because I always like to do the process with somebody. I like to go through the process with someone rather than just having a finished product where everything is just done for you. I'd much rather do the journey with someone than do it by myself and then find them by the end of my journey. That certainly does not mean that I have anything against arranged marriages or people who go ahead with those. But for me, in my mind, in my perspective, it's always been this way. I like to do life with somebody before I do life with someone. And while I never deny that arranged marriages don't have that, post marriage both are going to have equal share of struggles. But at least in a love marriage, you know what you're getting into, and you will expect accordingly. You know what the person's temperament is like, you know how they're going to react, you know what their understanding is about certain things. They understand you, your moods, your everything. So for me, that just works better for me. And at least being a therapist, I think it helps me a lot to go back and look into what's happening, and you know where we can make changes and where things can be changed. So it's just from a personal lens, but that never ever has affected my opinion on my patients. You do a love marriage, do an arranged marriage, you don't do marriage, like whatever your decision is, like as a therapist there will be no judgment from our ends, because we've always been taught to be that way, and we will always be that. This is a safe space. Anything else, you can always reach out to me and I'll be there to help you. Thank you. This is Sonakshi from Clinicking Mind.